So hello everyone, it is such a pleasure to connect to all of you today and do the recall of the questions that were asked in this year's NEET PG exam. And I am here, I'm going to, I've already discussed most of them in the marathon, so I'll just quickly review them for you so that you can calculate your rights and wrongs of this NEET PG exam. But before I start the session today, I have a very important suggestion for you. This is like suppose I am gave this NEET PG exam and you feel that you have done fairly well, and you are thinking maybe after the result I will think about the November INI-CET also. That thinking is wrong, because if you are thinking of November INI-CET, you need to think about it today. Because if I keep waiting for the result, then after the result, after the counseling, if I decide then the time is too little. If I start today, there is enough time to target the November INI-CET paper also. So that is one of my suggestions. If the exam did not go up to your expectation and you found that the paper was above your level or it was very tough, then it is the time to think about the May INI-CET and the June 2026 in NEET PG exam. You have to target intelligently, because targeting the paper based on your preparation level and the time that you require will help you to crack the paper. For example, if you're just starting and if you're starting your study and you target an exam 3 months later, it is better to give yourself maybe 6 to 8 months. If you have already studied and you want to improve upon, then target the INI-CET paper in the November. That is my suggestion that I wanted to give you at the beginning itself. So let's look at the first question. So this is the lady with 70-year-old, chronic back pain, and X-ray was shown to you. Now we have discussed on the Telegram and we have discussed it on the various social media, and 99% people agree that there was a anterior slipping of the vertebra over another. You can see there is a step-like deformity. So once you see this, this is definitely spondylolisthesis. There was no choice saying spondylolysis and spondylolisthesis in a single choice. Spondylolysis means break in pars interarticularis. And if you remember from my marathon revision that I did on YouTube before the NEET PG exam, I predicted spondylolisthesis is the favorite topic of NEET PG, and I'm happy we could directly predict it in the marathon itself. So if you remember, we discussed beheaded Scotty dog appearance is spondylolisthesis, Scotty dog with collar is spondylolysis. Okay, and TB spine would have the loss of disc space, paravertebral abscess, and those kind of things written in the question. Okay, are you able to remember this? Okay, beta, very important question. So let's see the second question. This is a question. There is a this year I have seen that, and another observation that I wanted to make today is, I have seen in both NEET PG and FMGE exam, because the board is common, questions of one exam are repeating in another exam. That is why, if you remember, before your exams at DAMS, we conducted a session of NEET PG and FMG PYQs together, and that single session has helped our FMG students as well as NEET PG students massively. And I would strongly recommend that for INI-CET, you look at the INI-CET PYQs. For NEET PG and FMG, look at the both the PYQs are important. Okay, so this is an IVP image. How do we do IVP? IVP is done by IV injection of iodinated contrast, which is excreted by the kidney, excreted by the urinary tract. Okay, so is it useful for bladder cancer? No, it cannot evaluate the bladder. For bladder cancer, either we'll do a CT scan of the bladder or we'll do a MRI of the bladder, but not IVP. Is it non-invasive? Yes. Can it diagnose PUJ obstruction? Yes. It is a previous NEET PG question, that if there is ureter, if it is not visualized and you see a dilated pelvis even in the delayed film, think of PUJ obstruction. Is it a percutaneous procedure? No. Is it invasive? No. Somebody said it can also be used for urinary stones? No. So the correct answer is IVP is a non-invasive procedure, can diagnose PUJ obstruction. So next question was slightly controversial. There is a pulsatile mass which empties on swelling and it clears gradually. So if there is a mass which is emptying, it swells and then you empties, then we are thinking of a pseudoaneurysm. Usually history is suggestive of a pseudoaneurysm. Okay, but when you look at the radiological image, it tells you this is your classic liar sign, and 100% of the students agreed that this was the image. there was splaying at the carotid bifurcation. This indicates a carotid body tumor. So although your history was slightly suggesting to you carotid pseudoaneurysm, but the radiology is telling you this is not pseudoaneurysm, this is a tumor which is causing splaying of the carotid bifurcation. If it was a pseudoaneurysm, you should see eccentric swelling in one of the carotid in the internal carotid artery. That is not seen here. The question had splaying. This was the exact image in the question paper. That means the answer is carotid body tumor. So try to understand what you do in a hospital. In a hospital, you have a clinical suspicion of a disease, then you advise radiology. In clinically, you might be thinking of two things. Radiologically, we narrow it down to the final answer. So if there is many students got confused. If there is a mismatch between your clinical history and radiology, a radiological image has to be given the importance because there is a clear cut splaying of the carotid bifurcation. This is what is called as the Liar sign. This is known to be a feature of carotid body tumor. So I hope this helps you. Okay. Are you able to answer this? Okay. So let's see the another question. So this is another one of my predictions. I always tell you, if you have attended my class, you will appreciate. I always tell you, out of these 5 tumors, one will come in your NEET PG exam. You can write it down for the next exam also, beta. Vestibular schwannoma, patient will have deafness. Pituitary macroadenoma, they will say bitemporal hemianopia. Pituitary macroadenoma. Okay. Craniopharyngioma, suprasellar cystic tumor, solid cystic tumor in a child, machine oil content, craniopharyngioma. Meningioma, dural base, dural tail sign. Glioblastoma, crossing the midline. Out of these 5, one is always there in your NEET PG exam. You can write it down. And even if you go to USMLE exam, don't forget, this will be the tumors that they will ask you. So we know this is a 30-year-old patient. MRI shows a solid looking tumor. Where is the tumor? It is abutting the dura. It is dural based. It is a dural based tumor, must be arising from the dura. Dura is meninges, and it shows the dural tail sign. It shows the dural tail sign. What is your answer? Meningioma. Meningioma. So this is how you think of it. Why it is not a pilocytic astrocytoma? Pilocytic astrocytoma in children, first of all, the patient will be a child, will be seen in cerebellum with a cystic tumor with a mural nodule. In cerebellum, or pilocytic astrocytomas can also be seen in the optic pathway. Okay. And also remember, glioma is a intraaxial tumor, so it will not be dural based, it will be within the brain parenchyma. Ependymomas are usually seen in the 4th ventricle. Ependymoma usually seen in the 4th ventricle. Okay. So next is an image which is slightly, I'll give you a sample image. Lower abdominal discomfort, around 35-year-old female. I just want you to understand the concept. MRI today, and if you remember from my regular class, I spend a lot of time explaining to you that MRI has a lot of role to play in female pelvic imaging. It helps us in adenomyosis diagnosis by looking at the junctional zone hypertrophy. It helps us in, keep this in mind, endometriosis diagnosis. Deep-seated endometriosis has that mushroom cap-like appearance. Remember from my class discussion, it also helps us in staging for CA cervix, looking at the parametrial involvement, also helps us in Mullerian abnormalities. So this particular image, this white line that you see here is your endometrium. And posterior to the endometrium, abutting it, so it is, you can see this area here. I'm going to mark it for you with a different color. This area is the junctional zone hypertrophy, with some tiny little hemorrhages in between because there is endometrial glands in the myometrium which are gone. This is adenomyosis and this is junctional zone hypertrophy. For the next year's NEET PG exam, I want you to remember this particular area, beta. Between the rectum and the uterus, you will see a mushroom cap-like appearance like this. So if they say mushroom cap-like appearance, keep that in mind. That will be endometriosis. And people will not look at the questions. People will just keep mugging this up. Next year, they will not ask the same question. They will ask the previous year topic. Endometriosis, the MRI sign for deep rectosigmoid endometriosis will be mushroom cap appearance. So I am predicting this as a future question. So that is the value of, a teacher telling you the previous year questions, discussing DVTs and your LRR. Please follow what we are telling you, because when a subject specialist is teaching, his prediction is more accurate. Okay. And this particular question, many people got confused. Is it a X-ray? No, this is a barium swallow image. Okay. So whenever we do a barium swallow in the upper esophagus, you see two outpouchings like this. One here, can you see it? And one below it. Okay. So, and this is the area of your, let me just mark it for you, epiglottis. This is your epiglottis. This is the median glossoepiglottic fold. So I hope you can see my pink arrows are barium collected between the epiglottis and your tongue. So you can see two fossae there. These are your valliculae. Okay. And at the bottom you can see there's some barium accumulating in this area. This is between the aryepiglottic fold and the thyroid laminae. This is your piriform fossa. Okay. So, and it's a very hot favorite. They like asking this anatomy in the exam. This is your piriform fossa or piriform sinus. This is the answer. It is between the thyroid laminae and the aryepiglottic fold. Why it is not the vallicula? So, yaad karna, the one that you see above is the vallicula, you see below is the piriform fossa. Okay. Okay. So, patient had stiffness of back. X-ray of the SI joint is normal. The patient has anterior uveitis. So, stiffness of back, anterior uveitis, we are having a suspicion of ankylosing spondylitis. Ankylosing spondylitis would start as bilaterally symmetrical sacroiliitis. But then you will ask me, sir, why the X-ray is normal? In the initial stage, X-ray cannot show you the, changes of sacroiliitis. Initially, you need to see the bone marrow edema, which can only be seen if we do a MRI, specifically, remember for the next year's exam, STIR sequence. So answer is MRI SI joint to look for your sacroiliitis. If you have attended the regular class, when we were discussing the radiology of ankylosing spondylitis, I told you that they will ask you what will you do first. MRI will be the answer, not X-ray, not CT. And I'm very happy that all the students who had attended the regular class or the back to basics video on the app got it right. Okay. So X-ray, spine changes are later. SI changes are first. So don't go for X-ray, LS spine. Don't think bamboo spine, because bamboo spine will happen late in the disease. If you remember, we discussed it at length in our regular classes. Now, next image, I know there is a lot of controversy in this question because nobody knows what was the image. You had to look at a patient with flank pain and the image was shown. Most people said that below the liver there was a cystic mass like this. Some people said kidney is visible, some said kidney is not visible, some people said that maybe the ureter was visible, some said not visible. I have my own doubts, but what I feel is that if you are taking a section more anteriorly, then you will see the gallbladder, and this is one of the, I remember from the past, it is one of the previous questions also, that the same question has been asked in the past also. Sometimes I feel that what students are thinking as the ureter, maybe that might have been the, the stent or some the biliary stent that might have been placed in that patient for palliation of jaundice. Maybe sometimes you get confused. So if the kidneys were not visible and you see a cystic mass like this hanging from the liver, below the liver, this is gallbladder. This is a tumor of gallbladder. So the best answer was gallbladder mass. However, this image has not been recalled by any student. So we don't have the exact recall from the exam. So that is why, to the best of my understanding, when I hear the description, I believe it was something like this. But I know, there are differences in opinion based on, there's no opinion difference. Actually, it is the image is not available. Well, otherwise, once we see the image, we can diagnose. So this is my thought. Another thing that some people were saying was that, the patient is having flank pain. So it's a very non-specific thing. You don't make a diagnosis ke body ke kahan ka tumor hoga based on the flank pain. Second thing, some people were saying the problem was on the left side. So beta, you need to know on radiology, this is right, this is left. Okay. And why would they give liver, gallbladder in the choice if they were not looking at the right-sided problem? I still feel that the question was trying to show you a gallbladder mass because it is more anterior. If you saw the spine in the center, then it would have been more retroperitoneal. And I believe it is not the liver which is involved, it is primarily a gallbladder lesion. So I think this was the answer. And I still, feel that, some people are saying ureter was visible, but none of the student has been able to show me the image of the exam. So I have to be sure that what you are saying as ureter was ureter. I really don't know what you saw in the real exam. Because if the ureter was opacified, they are looking at a delayed film. It is unlikely to show you a delayed film on a tumor of kidney. So most likely what you thought was a ureter, maybe some biliary stent was there. I feel, Harshit, on the chat box, I feel maybe people are getting it wrong. I have a strong feeling, but there would be differences of opinion because the exact image you are not able to show me. If you show me, I'll be able to give you even better description. Similar confusion, child with high grade fever, cough. It is a previous question. There is no doubt on this question. But again, you see, small bachas getting confused. This is your, and usually, some people who have not worked in a radiology department enough, sometimes when they are talking, they will say trachea is pulled to this side. No, beta. Trachea is central, but a normal trachea can be towards the right also. That is anatomy. You go back and see, even in medicine, they told you when you palpate the trachea is central, but slightly towards the right is okay. You have to look at the position of the fissure. If you remember my discussion from my class, I told you looking at the fissure position is much more important. So if the fissure is at normal position, that means there is no volume loss. Patient has fever, cough, no volume loss. What do you think? This is consolidation. This is definitely right upper lobe consolidation, and this is one of the previous questions. So there is no doubt this was the image, and there is no doubt that the answer is right upper lobe consolidation. Whatever anybody else is saying is wishful thinking, because after you give the paper, you try to justify with trachea. But I told you in the class, if you remember, I told you in my class that don't just look at trachea. Fissures are equally important when you look for collapse. This was right upper lobe consolidation. And look at fever, cough. अगर किसी को बुखार खांसी है, पहले हम respiratory infection सोचेंगे ना. Why think of anything else? So that was the answer. There was no clear air fluid level, and this is not air, so this was not pneumothorax. Again, one of the questions that I had predicted, I'm very happy to include this in my discussion because I predicted the exact question in the NEET PG marathon on the DAMS YouTube channel. I told you Perthes disease is one of the hot favorite. You could see flattening of the femoral capital epiphysis, increased density. All this is pointing towards osteochondritis of the femoral capital epiphysis, which is called as Perthes. Next year, they will ask you the IOC, investigation of choice, MRI. Investigation of choice, MRI. So that is one of the questions that I wanted you to remember. It is not slipped capital femoral epiphysis, in which you will usually have an obese patient going to an endocrine OPD, and you look at the Kleene line and the Tirthoven sign. That was not given in the question. And this is not tuberculosis of the hip, because you can clearly see that the femoral capital epiphysis is flattened. This flattening is hallmark of osteochondritis or Perthes disease. And again, this is a previous question. I have no doubt this was the question in the paper. And another question that I am sure you have seen this before. There was bowel loops going into the left hemithorax. The heart and the mediastinum was pushed to the other side. Diaphragmatic hernia is the answer. Next time they will ask you which foramen. Bogdelic. Bogdelic hernia is left posterior, while your Morgagni hernia is right anterior. Remember, Morgagni hernia is right anterior. And if you remember from my classes, if you have attended the regular class or my TND, remember in TND I had a discussion at length. I told you that पिछली बार CPAM आया था. Remember, pulmonary adenomatoid malformation. I told you next time either they will show you diaphragmatic hernia or sequestration. So sequestration is my predictor for NEET PG 2026. That time they will show you blood supply from aorta. Mark my words. Looking at the previous year questions and the topics, this is the next predictor for 2026 NEET PG exam. Okay. And what is the best method for diagnosis? It is directly a straight out of my classes. This is your achalasia cardia, bird beak appearance, and confirmation is done with manometry. Okay. And I'm sure most of you were able to do it. And one question that I'm pulling into my discussion is patient had knee surgery 7 days ago, because I told you in the class some knee or hip surgery, and you have a breathlessness, sudden onset, think of pulmonary embolism. What will be the investigation of choice for pulmonary embolism? CT pulmonary angiogram. CT pulmonary angiogram. And second was one question, I don't have it written here, but it was a child with a cystic suprasellar mass with keratin, that is craniopharyngioma. We discussed this also at length in our regular classes and on the Back to Basics on the DAMS Alpha app. So I am, very clear on it. I am very clear on it that all we need is some concepts and application. Okay. Now the problem in preparation is many people, what they are doing is they are only doing MCQs, they are not having the concept. So then you create silly mistakes for yourself. The vice versa is also not correct. Some people only do theory, don't do MCQs, they also are not able to kill it. The idea that I wanted to share with you is this combination. So if you remember, like in all other mobile app platforms, you will see they will have 3 plans. On the DAMS platform, you will see the 4th and 5th plan. That is only unique to the DAMS Alpha app. So most people at the 3rd will have the topmost will be the recorded lectures. So that is there in the DAMS as called as Back to Basics. What we have done is we have gone a level up to help you. We have created a level called as App TND. App TND includes Back to Basics. It includes Back to Basics, but also has weekly tests and discussions. At length, teacher will try to cover the concepts for you, revise for you, and you will have some targets. And above it, we have a platform, topmost level on the platform called as App Live, which is daily live. Teacher will teach you daily live, plus you will also have live TND, and plus you will also have recorded lectures. That is the most premium variety where you have, like, how do you build concepts? You build concept by interacting with people who know their stuff. You interact with teachers. So if you are very motivated, you can interact with teachers on a recorded lecture, that is DAMS B2B. But if you need help, TND and App Live will help you to interact with the teachers, interact with the specialists, then build concepts. This is not physics, chemistry or maths that you can learn by some God gift. Medical science has to be learned with mentors. We have to interact to learn the concepts of the medical science. So that is why on DAMS plan, on the DAMS Alpha app, the newly launched AI powered app, you will see 2 more subscriptions which will give you the extra edge. So I wish you all the best and my best of luck for your exams. I am sure you will do well in your NEET PG exam. I am looking forward to meeting you all after your results to take an interview here. And also I have one more request for you. My request is, NEET PG jaisa bhi hua ho, please prepare for November INI-CET. NEET PG jaisa bhi hua ho, please prepare for November INI-CET. It's a good opportunity. It's a good opportunity to be in the best college in the country. अभी छोड़ो मत. ऐसा लग रहा है कि थके हो, थके नहीं हो. 1 महीना रिजल्ट आने में लगेगा, फिर काउंसलिंग होगी. तब तक तो तू नवंबर INI निकाल लेगा. ये रैंक तेरे को फर्क ही नहीं पड़ेगा, बिकॉज यू आर गोइंग टू क्रैक दी सेंट्रल एग्जाम्स. सो प्लीज कीप वर्किंग टूवर्ड्स दी सेंट्रल इंस्टीट्यूट्स. बहुत इंपॉर्टेंट अपॉर्चुनिटी है. जैसे आपने पूछा कॉन्सेप्ट्स कैसे बनेंगे, अच्छी एकेडमी में जब हम लाइव क्लास पढ़ते हैं तो कॉन्सेप्ट बनते हैं. उसी तरह से अच्छे एमडी कैसे करेंगे, जब बड़े कॉलेज में एमडी करेंगे तो हम ज्यादा अच्छा सीख पाते हैं. सो विश यू ऑल द बेस्ट. कीप रॉकिंग.